Back here in the United States, Maryland is set to become the first state in the country to use money collected under the Affordable Care Act to pay for abortions. This is thanks to changes from insurance. The old line state has around $25 million, and lawmakers advanced two measures to put the money toward abortion, saying that most people believe it is health care. A major pro-abortion group is suggesting that U.S. states should stop reporting their abortion data. The Guttmacher Institute recently said that self-reporting the number of abortions in each state can be, quote, vital in shaping public policies to improve reproductive health access and outcomes. But the group also says that mandatory data collection should be used to, quote, harass or prosecute abortion facilities or women who obtain abortions, and now pro-lifers are responding. Writing in the National Review Online, Michael New says that it is highly unlikely that abortion data would be used to criminally target anyone. He also says that since the overturning of Roe versus Wade, accurate abortion data is even more important. And the author of that piece joins us now. Michael New is an assistant professor of social research at the Catholic University of America, and he is also a senior associate scholar at the pro-life Charlotte Lozier Institute. Michael, great to have you back on the show. First, I know you say that since the overturning of Roe versus Wade, accurate reporting on abortion data is more important now than ever. Tell us why.
Yeah, sure. That a lot of states have taken the lead and passed good, strong, protective pro-life laws, and those laws have done a lot of good. But in some cases, women circumvent those laws. They obtain abortions in other states where the laws are more permissive. They obtain chemical abortion pills through the mail. So really tracking accurate abortion data is a lot harder, but also a lot more important in a post-Dobbs world.
Yeah, I know you also mentioned the official abortion data from the Centers for Disease Control is really not very good. Let's talk more about that and why those numbers aren't really helpful. And do you think maybe they might improve those numbers and this reporting out of the Trump administration?
Sure. There's a lot of problems with the official data reported by the CDC. First off, it's not timely. The most recent data we have from the CDC is from 2022. That's a problem. Secondly, a lot of states don't report abortion data to the CDC. California has not reported any data since 1997. Other states like Maryland and New Hampshire also frequently don't report data, so it's incomplete. Even those states that do report data, they often don't give a helpful breakdown. They don't provide information about the age of the women who obtain abortions, the gestational age of the children who are aborted. So it's kind of weak data. With the Trump administration, we can hope the CDC will tighten this up and strengthen reporting standards. Frankly, past Republican administrations haven't really been able to do that, but there are some good pro-life people, in the Trump administration, and we can hope for better, more accurate data from the CDC.
Yeah, Michael, are you surprised at all about the Guttmacher Institute and asking states not to report abortion data?
Not really. I think pro-abortion groups have always prioritized permissive abortion policy over good public health. And accurate data on abortion, I think, would serve everybody well. It will give us good information about things like the impact of contraception programs, sex education programs, various pro-life policies. I think it's just sad that they're prioritizing just permissive abortion policies over good public policy and good public health.
Yeah, and Michael, really quickly before I wrap up, I'm wondering, why is it that some states aren't reporting this information and others are?
That's a good question. The states that aren't reporting tend to be states like California, Maryland. These are states with very strong pro-abortion sentiment. Why they're not complying with, the CDC rules is puzzling. But again, I just think they oppose any kind of oversight, even minimal oversight. They want the most permissive abortion regime possible, and that's kind of what they have.
Yeah, and hopefully things will change under this new administration when it comes to those numbers. Michael, thank you so much, and thank you for what you do. We appreciate it. God bless.
Thank you.